When healthcare information is accurate, lives are protected. This is Doctors on Air, Nigeria's trusted space for evidence-based medical dialogue. Today we'll be talking about cervical cancer and why every woman needs a pap smear. Joining us on the program are Dr. Faye Iketebosin, consultant gynecologist and medical director of George's Memorial in Lekki. And we also have with us a survivor, Franca Eze. You're welcome to the program.
Thank you. Good morning.
We want to talk about cervical cancer. Dr. Faye, can you tell us what is cervical cancer and why should women be concerned about it, particularly women in Nigeria?
Cervical cancer is cancer of the neck of the womb. The cervix is the neck of the womb. It's a very, in about 10 to 14,000 women will be diagnosed with cervical cancer every year in Nigeria. And of this, about 10,000 women die from cervical cancer annually. So it's quite an important illness. And what's most comforting about it is that it is preventable.
Exactly.
And it also can be curable.
Yeah.
So it's very, very important that women are screened on a regular basis for cervical cancer.
So I think understanding that cervical cancer is preventable. Well, first, I want to dig deep into it. Understanding from you that cervical cancer is a killer, that's what you just said, in Nigeria. Is it common in Nigeria? Is it something that is more common in Nigeria than elsewhere? And can you just tell us what are the causes of cervical cancer?
Cervical cancer is caused by a virus called HPV, which is otherwise known as human papillomavirus. And there are various strains of this virus, but the ones that are responsible for causing cervical cancer are strains 16 and 18.
True.
And ordinarily, I mean, a lot of women may come in contact with HPV, but it is the persistent infection of HPV because the body's immune system actually fights it, and so it can clear in nature. But in women who have a persistent infection, these women are the ones who are most prone to develop cervical cancer.
And what are the signs and symptoms of cervical cancer?
The commonest symptom, and really we're talking about when it is advanced, because at the very early stages there aren't any symptoms. You may just get a discharge, which may be offensive. You can get bleeding after intercourse. And as the cancer spreads, you may get other symptoms like pain. And what is most alarming is the offensive discharge, because you'll actually walk into a room and the whole room begins to smell.
I had that. I had that smelly vaginal discharge. I had mouth odor, and I had recurrent sore throats. I equally had bleeding while urinating and occasional bleeding after intercourse.
I mean, I'm loving the fact that you're talking to us and relating to what it is that's being said. So when you have that, that's actually fairly advanced signs.
Because what happens is that by the time you're getting those kind of symptoms, there is already a growth on the cervix, on the neck of the womb, and it's an exfoliating kind of growth. It's quite brittle, and so it breaks when it on contact. It bleeds on contact, and it of course brings out this very severe offensive smell.
Yellowish.
Yes, yellowish discharge. Yes.
Discharge.
So, but when we talk about cervical cancer being preventable, that's not what we've just described here. What do you mean by cervical cancer is preventable? And what is a pap smear? And why should women go get it?
Right. What I've described is actually cancer. When we've got to the stage of invasive cancer. Now, but before the manifestation of cancer, the HPV virus, when it affects the cervix, it actually causes a persistent irritation of the cells and leads to changes within the cells of the cervix. Now, this is where the pap smear comes in, because a pap smear actually detects those very early changes caused by the persistent irritation of this virus. And it's such a good test because detection of these early signs can predict cancer that is going to occur in 10 years' time. So it gives you a 10-year window to be able to act and treat it effectively, which makes the pap smear one of the best screening tests there is in the world, because there's no other test that I'm aware of that gives you a 10-year warning of an impending dangerous disease.
Now, when you say that, and you say, on the other hand, that in Nigeria has one of the highest rates of cervical cancer deaths, they don't match up. If we know we have this simple tool to pick it up and get rid of it and prevent it from happening, then why are we dying from it?
Awareness, and access to screening. Now, in developed climes, almost every woman gets a pap smear. The system actually prompts her at intervals, 3-year intervals, to come and have a repeat pap smear or an initial pap smear. And the screening starts from the age of 25. Say from about 25, you start getting your letters to come have a pap smear done. In our climb, we're dealing with a lot of other issues, communicable diseases, and so on and so forth. And the awareness of having a routine pap smear isn't there. There's been a lot of campaigns by various NGOs and women's organizations, but if you reckon that 50% of the population of Nigeria are women, and if we have a population of 100 or 250 million or thereabouts, it means that there are over 100 million women who need to know about, getting screened. But I'll be surprised if 10% of the population are getting screened on a regular basis.
I would say that compared to when I was diagnosed, there is more awareness now than before. I was diagnosed on the 26th of June 2016, and that was like 9 years ago. Before I did that screening, I had never heard the word cervical cancer. But now, not only have I kept on raising awareness since I got well, but I can beat my chest to say more women are aware now. But what is lacking is the call to action. Not many women want to embrace awareness because of the fear of being told that they are either positive to the virus or that they are at risk of cervical cancer. There are many more women who would rather not be screened because they don't want to face their fears. Yes, I reject it, it's not my portion and all of that. Like we are in a world where cheating is not a deal breaker. So most women know that they are in a relationship with a partner who is in a relationship with another partner. So the level with which the virus has spread is more compared to when I was diagnosed. And we have more women coming down with symptoms. Some of them read these symptoms online. They know that they have these symptoms. They approach the screening with fear. So sometimes it's even difficult to communicate the results. And sometimes when they are told that this is what is going on with them, they live in denial, reject the result, and then maybe 4 or 5 years later, they come back when the symptoms have advanced.
And when there's nothing much that can be done.
Exactly. So, like doctor said, it boils down to awareness. But we have more awareness now than 10 years ago.
What you're actually saying is it's more than awareness that's needed. Because when you're talking about the fact that, we have more awareness, people are hearing, but then they're rejecting it, rejecting the diagnosis, rejecting the symptoms, and waiting until they're almost terminal before they come in for care.
Yeah.
So it's actually more than awareness that's needed. How do we communicate? Because it's more than just saying there's cancer, there's a screen, and it's free. A lot of times they're free screenings,
Yes.
and people don't go for them. So how do we get women, A, to go and take advantage of the screening, and then B, when they've had the screening and they've been told a diagnosis, that they actually go for treatment? I think it's bigger than just awareness.
Yes.
Yes, I agree. It's certainly bigger than awareness. It's more. It's also. I think there's also a cultural element in it. As a people, we don't like to hear bad news concerning health. It's not my portion.
Exactly.
It's not just and so
And
on
also
and so
the
forth.
fear of stigma.
Yes.
I was stigmatized.
Wow. Well, I think this is something we'd like to go into, but we'll go into it after the break. Thank you for coming on the program. It's actually very important what we've been talking about cervical cancer, and it's a pleasure to have you as a survivor here with us. You spoke on the previous half about being stigmatized, and that's the reason why a lot of people don't come in. Can you share with us the kind of stigma you went through, and how did you overcome it?
I never overcame stigma until I started raising awareness. I was stigmatized from the point of my first opportunity to be screened by the medical expert who was supposed to screen me. The first opportunity I had to be screened was at a health center around my area where I live. So there were women on my street and at the market where I shop who were there for screening. And the nurse said I was smelling and she didn't screen me. Imagine a medical personnel sending me away from the screening spot. I talk about it at every given opportunity that
Because
more
so
medical,
important.
yes, there need to be training, and they need, like I've seen a medical person call somebody, he only diabetes, a bossibi. So if we must address the issue of stigma, it has to start with the medical team. Nurses and healthcare workers need to communicate effectively with patients.
And be kinder.
And be kinder, yes.
I think there's an issue with empathy and compassion,
Exactly.
which I think needs to be done. But that was something that you had. But when you were in this society, were you shunned because you were smelling?
A lot of people stopped talking to me when I posted on social media that I survived cervical cancer. A lot of people don't even want to associate with me up till now because of the fear of being said that they are getting close to me because they want to get information about their treatment. So the stigma still goes on.
Sorry, that's a bit confusing.
Yes.
The problem is not that they fear they're going to catch cervical cancer from you.
They don't want to
They
be
are
close
afraid
to Franca.
that if they're seen with Franca, people will think they have it.
Yes.
Oh, that's not uncommon in our society.
But does it make sense?
It does. It doesn't make sense in the sense that it's you see it in other kinds of treatments, because we hold our illnesses very, very dear to our heart. In fact,
And
we're
hide it.
actually quite secretive. Even women who've had difficulty with childbearing, I mean, they go to a fertility hospital, they get treatment, but when they go to church, they say, God has done it for me. And that is true. If they meet the personnel from the hospital on the street and the market, they don't talk to them because they don't want that association that they went to seek help for a medical profession. So it's quite common.
Yeah.
And it's because we try to, we hide our ailments.
But the whole thing is wrong. You know, I've heard of, you know, people not knowing their father had hypertension. Think as simple as hypertension. The father or the mother doesn't tell the children that this is what they have. So the children grow up having issues and not knowing that it's actually something that they should have known about, something they could have taken steps to avoid or to prevent the complications. I mean, how do we break these kind of barriers? Because they absolutely don't make sense.
Well, they don't make sense, but I think we can't, for something like cervical cancer, which is preventable and treatable, I think what the government has embraced now, again, which is slowly gaining acceptance, is immunization of children, vaccinating the girls. Now, I remember when the idea was broached to give girls of 9-year-old girls
9 to 14.
Yes, 9 to 14, but at age 9, thinking of the age 9, mothers were very hesitant to bring their daughters forward for vaccination, and this is one of the interventions that has significantly impacted on the incidence of cervical cancer worldwide in societies where they've embraced vaccination.
So how is it now with vaccination? Are people taking it? Are more people taking it? Is it being offered in schools? Because at the time I heard that people were saying, oh, you know, if you give these women, they will be more promiscuous.
Yes, more people are embracing the vaccine. And a lot more people are not even listening to the right information about the vaccine because of the propaganda that came up while the vaccination was launched. I took my 3 doses of the vaccine after I had a child that I had after I survived. And it was my gynae who advised I take the vaccine. So I tell everyone who is willing to actually prevent cervical cancer that the right step to take to prevent cervical cancer is to get vaccinated.
Absolutely. And in fact, in abroad, because I know this because both my son and daughter have had it, boys have it, the vaccination as well. There's no reason why boys and girls shouldn't be vaccinated against this.
The vaccine for boys is not available in Nigeria, is it?
No, it's the same vaccine. It's the same vaccine.
The same?
Yes.
The same, like the same virus?
Yes, because the vaccine is against the virus, HPV.
It's not about whether you're boy.
So and both boys and girls can have HPV. So
I'm just learning this.
Oh, that's why you're on Doctors on Air.
Yeah.
And you have trusted facts here, and so you know that this is real.
Yes, thank you.
So when we talk about the vaccinations, we're talking about HPV vaccine and who should receive it. We've talked about both boys, girls, everyone should, you know, as much as possible, this should be done. How can we, you know, talk about risk factors and warnings? Who's most at risk of developing cervical cancer? And who, you know, if we have a limited number of vaccines, who needs to get it first?
Well, the vaccines are most effective in young girls who have not been exposed, and exposure comes through sexual intercourse. So if for the young ones, they get, at 9 to 14, by the time they've had the vaccine, they've developed immunity. So if they come across it later in life, they're already immune. And so they are the priority group. And I'm glad that some state governments, and Lagos State is one of them, has introduced it as part of the immunization program for the state. So it is available. The other thing is the cost. and I think in Lagos State they're actually funding it.
That's fantastic.
Which makes
Which is
it
really
for the young people.
So, Franca, if we can just quickly, I know we've talked a bit about your story here and there, just give a little summary of what you've been through.
Okay, so what helped me was early detection and early proper medical treatment with consistency in following professional medical advice. You know, I never knew anything about cryotherapy when I was diagnosed. It was later I was told that I did 6 sessions of cryo, and then I went for all the screenings I was told to do while I was undergoing treatment. I would say to any woman who needs to embrace proper medical treatment to please follow professional medical advice alongside with prayer. I did pray, I did fast, but I did everything doctors told me to do.
Very
and
important.
I advocate for professional medical treatments.
Thank you. I think that is, I wish, we need more people to talk about this because people go, and the medical world actually has a bad reputation because they say, that boy went to hospital and died. They don't know that that person came to hospital 5 years before, didn't take the treatment, now came back at the 99th hour and then died. Because there's nothing, hospitals can't perform miracles. If people don't take the right advice at the right time, what do you do? Yeah. And so I'm very happy that you are with us and you've taken the right, advice. And I'm happy I've met your son and everything. So it really makes me happy to be sitting here with you and thanking God for your life.
Thank you so much for having me. I always appreciate the fact that doctors understand my place in raising awareness to follow proper medical treatment. I don't encourage women to rub anointing oil and stay at home. Yes, it's important to follow professional. I tell women who are undergoing cancer treatment that successful surgery is an answered prayer. Body responding positively to chemotherapy is an answered prayer. It's not everybody's symptoms that will disappear at the instance of prayer. And I am a testimony that professional medical treatment is also a miracle.
It is a miracle. That's fantastic. Thank you very much for that, because it's something that we really need people to understand. In fact, the other day I went to an event and I spoke. It was a church event, it was actually a City of David event. And I talked to the whole group of women about the issues and why they need to come for screening, where they need to do mammogram, etc. And immediately afterwards, as I came down, somebody came to me and said, that my sister, I think she had a breast lump. For years, she didn't tell anybody about it. She was just going to church. And then, when it was too late, she now told everyone. But by that time, she had everything, mets everywhere. Mets means metastasis. That means it has spread everywhere. She didn't last 6 months after she told her family. So she didn't even tell her family. They just go into hiding. I mean, how it's you see, there's no point in just talking about this here because people know they have a diagnosis. So how do we break this? This is what I want us to know, to think about. How do we stop them? Do you need to go to 100 churches to talk to them? I don't know what it's going to take. I don't know, Pai. Do you have any ideas?
I think we need to keep on talking about it and give people hope. I think the fear is that whatever ailment or whatever symptom that they have is a death sentence, and it's not. Breast cancer is a very good example. If you detect it early, it's curable. And we've been singing this song about women do self-breast examination, and if you feel something, go to the hospital early, see a doctor, and get professional advice. We've been singing this song over and over, and we not just have to keep on singing it. And I think the message really is that early detection is is a cure, can be cured, and that's is a route to a cure. The more we encourage women to give them hope, not just women, but the more we encourage our population to be health conscious
Yeah.
and seek medical attention, when things start, when they notice something early, that if in those circumstances there is almost a 90% chance that it'll be cured. I think that's the positive message we need to emphasize.
I think we do. And I also think that it might be useful for us to talk to our corporates and tell them to insist on it. When they're sending out their staff for, treatment or for screenings, they need to say cervical cancer is an integral part of it and invite people to come and give talks in their place about it. I think these are the kinds of things that would be useful. If they want to talk to doctors, they can talk to doctors. They want to speak to survivors, they can speak to survivors. Now, unfortunately, our time is up. You won't believe it. It went by in a flash. But I just want you to give us last words for our listeners. First, you, Franca, I know you have a foundation. Do you want to just share the number, just in case anybody wants to contact you, either for you to give a talk to people or to support you financially? Can you just tell us about your foundation?
Okay, so we are currently running a free cervical screening for 500 women, and we are needing support. And we are also available to give health talk and offer counseling and help support women undergoing treatment.
Your phone number?
We are called My Body, My Asset Cancer Foundation on all social media platforms. And our phone number is 081 099 10868.
Repeat.
081 099 10868.
Thank you. Dr. Faye, do you have any last words for our listeners?
Yes, the simple message: cervical cancer is preventable and it is treatable. So please, every woman who is between the ages of 25 to 65, go and get a smear done today.
Thank you. Certainly. I think so. And if you can't get it done today, please get it done tomorrow. So I think really we need to just push that if every woman that hears this message gets a test done before the end of the first quarter, I think we would have done a huge job. So I want to say thank you to both of you for coming on the program and for sharing your information, because Doctors on Air is a place where we have trusted advice, trusted information. And I'm hoping that this will make a difference and encourage all women to go and have a pap smear. Thank you very much.